Okay, hello everybody. I'm very excited to be with Seb tonight. Before I properly introduce Seb, I'm going to now use all my technology skills and go live.
I'm gonna do it.
And it's going to work. It's just going to happen. So just doing this now. And in fact, I'll check it on my phone.
It says it on mine now. Meeting is streaming live on Facebook. So I think you pressed something right.
Okay, amazing. So we should be joining you guys live on Facebook. I'll check it on my phone.
It says it on mine now. Meeting is streaming live on Facebook. So I think you pressed something right.
I think we're on. Okay, amazing. So we should be joining you guys live on Facebook. I'll check it on my phone.
It says it on mine now. Meeting is streaming live on Facebook. So I think you pressed something right.
I think we're on. Okay, amazing. So we should be joining you guys live on Facebook. Okay, I'm just thinking now though, if I can hear myself on Facebook.
Meeting is streaming live on your
I think we're on.
phone. Going through? What's? It seems like it's looping.
Live on Facebook. Okay, I'm just thinking now though, if I can hear myself.
Meeting is streaming live on your phone. Going through? What's? It seems like it's looping.
It is. So
Wait.
I need to I can hear myself.
Let me just check it's not on mine. On your phone? What's? It seems like it's looping.
It is.
Wait. Let me just check it's not on mine. No. On your what's? It seems like it's looping.
It is.
Wait.
So
Nathan to the rescue! Let me check it's not on mine. No. On your what's? It seems like it's looping.
it is.
Wait.
So
Nathan to the rescue! Let me check it's not on mine. No. That sounds better.
Can everyone on the Facebook Live hear us? Just put in the comment if you can hear us.
Okay, so we just mute that one then.
Can you hear me, Seb?
I can hear you, yeah, I can hear you.
Okay, I just want to make sure everyone on the Facebook Live can.
Yes. Okay, amazing. So you just muted Facebook Live, basically.
It was just repeating, wasn't it?
Yeah.
Not really sure why it does that kind of thing. But
Yeah. Okay, that's brilliant. Thanks, Zoe. Because then we've got Facebook Live going. All right.
you can have
Okay.
it. You can have it both here now. So.
Perfect. That's amazing.
And then you want to record there, don't you?
Oh,
Hey, Seb.
Thank you. Good to see you.
Good luck.
Thanks, Nate. Okay. Perfect. Okay, sorry about that, everybody. Can always expect a few technical things when I'm in charge. So welcome, Seb. Thank you so much for your time. I'm really excited to introduce Seb. I personally heard about Seb, I think about 3 years ago. Did you start doTERRA 3 years ago, Seb, when you came?
Yes.
Okay. So Vanessa, one of my lovely work colleagues, she came back from an event, very excited, telling me about this incredible couple that she had met, and that she was thought they were wonderful and loved the oils, and I think then were you studying to be a holistic dentist? Is that right?
Yes, that was it. Yeah.
Okay, so she was really buzzing about that too, and I was buzzing about that because there's not many holistic dentists actually, and Seb is so good at what he does that we actually drive 5 hours to see Seb. Seb is our dentist. And
I appreciate every minute of that drive.
with our 3 kids, so it's 4 children we've got. And our kids came away from that first session literally so happy. They were like, I didn't know going to the dentist would be so fun, mummy. And so I highly recommend Seb as a dentist. But tonight, I'm really excited to get lots of tips from you, and I'm sure lots of people are really excited for that too. So I'm going to just start, Seb, by asking you, as a dentist, what first attracted you to the oils? What was it that made you like?
My wife.
Okay.
And her nose. But so my first degree was in chemistry and my second degree was in dentistry, so I'm just a questioner and a skeptic around everything. And actually, even my nose could smell the oils when we met Vanessa that day. And actually, I did the peppermint experience and the wild orange experience, and instantly I could tell, that's doing something, right? So my mind was already open. So that's good for any skeptics you have out there. Just let them feel and experience that breath of fresh air that clears your sinuses. And after that, that's when the research happened. And after I went on the call with Ali and sat in and listened to it all. But of course I said, no, we're not getting straight away. I need to go and do research. I need to go and do this. I need to look on PubMed. I need to,
Yeah.
It was just ridiculous. And, after 2 months of researching and looking about, I think for me, luckily, I had the chemistry understanding of how oils can interact with our cellular biochemistry. And when I looked at the research, it made sense to me. And through making sense, I said, well, let's get this intro kit. Let's trial and error it. Let's test things on each other. And you know how it goes. It just grows. You do it friends and family. And then it just, so that was it. It was first my nose or my wife's nose. And then it was me and my research.
Amazing, brilliant. And that's great to hear as well, because not everyone does that research, but it's lovely to hear when professionals come on, because obviously that is your field and you want to really understand it. So it gives other customers, I think, confidence in using the essential oils.
And obviously doTERRA being doTERRA, with the testing, the extra testing, the third party testing they do, you can be confident in the product, which is the main thing that I saw. And even when I heard it on the call, I was still skeptical. But obviously, when you go onto source2u.com and you look at the batch codes and you understand the compounds in each of them, there's no NARCs in there. It's been certified. And the Aromatic Plant Research Centre have done all of that themselves. It's just fantastic, isn't it? So that's what gives you the assurance. And now, like, you've been to our clinics, the longer I've worked at this new clinic, the more and more oils I've brought on and we've been using into all of them, because I've got that free reign without the NHS anymore. And actually, it's working fantastically, and patients are absolutely loving it. So it is amazing.
That's fantastic. Yes, and I've experienced that. I love seeing the doTERRA oils everywhere. So tell us, like, when a new patient comes to you, what are the key things that you look for to kind of assess their oral health?
Yeah, so that's huge. And as you know, we look for different things, but I'll start with probably what most people look for, most dentists look for when you come to see the patient. And the first one is the state of the gums, whether they're bleeding or not, whether they're inflamed, whether there's pockets between teeth where there's been previous gum disease or active gum disease. And that is probably the first foundation pillar to do with systemic health. And now, and even science, conventional wisdom right now is linking gum disease with Alzheimer's, with cardiovascular disease, with infections in the blood, everything. Even the more recent studies that I'm reading is leaky gums, because that's when your gums are leaking blood, links to leaky gut, which we've all heard around, why we do our cleanse and restores. So that's a good indication of your gut health just from looking at your gums and seeing if there's bleeding in places, because it's the same mucosa, same cellular makeup. But even more recently, the whole Alzheimer's and dementia topic, which they're putting a lot of money into at the moment, they're saying that it's very similar cell walls as in the brain and blood-brain barrier. So if you've got leaky gums, you've probably got a leaky blood-brain barrier, which is obviously inflammation. So they're linking it to all these different parts of the system now. So for me, that is the foundation of health, even to start with. And it's simply as easy as getting better at brushing. There are other factors that, come into these places and different techniques you can use, but I'm sure we'll touch upon them later. But that is normally the first thing that we look upon.
Okay, that's amazing, isn't it? Because that does connect the whole holistic approach together, because it's like your gums are a sign of what's going on in the rest of your body. It's not just isolated
Absolutely.
To your mouth. And I heard, and correct me if I'm wrong, but each tooth is like an organ.
Yes, so this is still very debated over in the Western world, but if you go to China and if you go to South Korea, they link everything to the tooth meridian chart and the organs that it's associated with. And what's very fascinating to me is that say a patient comes in and they need a tooth out, and I always say, okay, let's just look at, see what organs that's related to, and obviously I can't say it's going to fix or do anything, but you just make the correlation. I say, oh wow, because the most common one is lung, large intestine, and they're the teeth that I most commonly remove. And a lot of the patients at that time said, oh, I've had IBS for many years, or I've had colitis for many years, and you just think, wow. And then you have to think, which way is it, chicken or the egg, right?
Absolutely. So really the importance of looking after your teeth is huge, like way more than just like avoiding that filling that we all really dread.
Exactly. It's bi-directional, and they're linking that with the gum disease for sure. But I think it's going to soon, probably in my career, they'll be linking the actual teeth. Well, the thing is, we forget that teeth are actually alive. They're not just these things sticking out of our gums, that are dead. They're alive. And you appreciate that when you've had toothache, right? But the inner part of the tooth is your nerve and your blood supply, which is very much alive. We all know that, because that's what our body is made of. And then you have this layer called dentine. And in this dentine, it's about 60 to 70% mineralized, and the rest is organic material, which is living tissue. And it's only on the enamel layer, which is our strongest part of the tooth, which is 96% mineralized and hardly any water content and organic material. So 2/3 of the tooth are pretty much alive. So that's why you have to, and that inner part between the nerve and blood supply and the dentine layer actually have cells and stem cells in there that can regenerate and remineralize. And I'm sure we'll talk about that a bit later as well.
Amazing. Wow, it's fascinating. So what are the main holistic techniques that you would, suggest to do for a patient to do? And can you link in some oils as well? So maybe take us through the basic things that people can do to, manage their own oral health care, and what oils, as well as the techniques, if that makes sense.
Yeah, absolutely. So for me, I think, interestingly, I'm not going to say everyone do this, but now I only brush my teeth once a day, and it's at the end of the day, right before bed. And the reason I do that is because when you look after your nutrition and the foods you eat and the way that you breathe and all of these things that I'm sure we'll touch upon, the plaque in your mouth can be beneficial to your teeth because it acts as a reservoir for good minerals to go into your teeth. And it builds back and remineralizes your teeth. And I'm not going to say everyone go out and do that, because there's so many factors that can go against that. But I've been trialing it on myself for maybe 2.5 years, and I thought, oh my gosh, I have smelly breath in the morning, I'll have this, I'll have that, and you don't at all. And it's really fascinating. And that brings me on to one of the first things that I do in the morning is I wake up and I tongue scrape. So what we do is you have a copper or stainless steel one, and you literally just hold out your tongue and you scrape off everything that's onto your tongue first thing in the morning, as soon as you get up. And the reason I do that is because your tongue is actually, so that's the front of your tongue that you see, and this is the back of your tongue. And the front of your tongue has tiny little papillae on it, like cat-like hairs that live on the top of the tongue. And what happens is when we eat food, when we go throughout the day, when we breathe through our mouth sometimes as well, all of that food and bacteria, it's just like a breeding ground for bacteria, fungus, everything. So if we don't scrape that off of our tongue every day, and you know about your gut microbiome and how you have to balance the good and bad bugs living in your gut, it's the same thing for your mouth. And if you balance the bacteria and everything within your mouth and the fungus, every time you swallow and you're actually ingesting beneficial bacteria rather than harmful bacteria, it's more out of balance. And one of the easiest ways to do that, everyone thinks of the teeth. The teeth are probably 20% of what's in our mouth. The rest of it is tissues, tongue, cheeks, roof of the mouth. We have to care for all of it, absolutely all of it.
That's amazing.
So 100% tongue brushing.
Okay, that's incredible. And do you use any oil with that, or just tongue brushing?
So there's a few oils that you can use. Like On Guard is obviously incredible, but it's quite potent. So what I tend to do is I don't tend to do it. If I had a sore throat and I felt a tickle coming on, I'd pop On Guard on my tongue and brush it off because it helps balance the bacteria.
Yeah.
But 9 times out of 10, I just tongue brush on its own. But what I do after my tongue brushing is teaspoon of coconut oil.
Okay, yes.
Yeah, and I swish this around while I'm doing my exercise. I'm doing a bit of meditation. I'm getting my lunches ready, my breakfast ready, and I have a drop of On Guard in that every day. And what that does is it actually coats your teeth with it's saponified, so it puts a very thin layer of stuff over your teeth. And do you remember that calculus that you go to the dentist and they scrape all of this stuff off and they get that horrible
Yeah, yeah.
that's that calculus buildup that gets everywhere. But if you swish your mouth for 20 minutes a day, I've not had calculus buildup since I started. That was 7, 8 years ago now. So, and that is purely the only thing that I've changed there. Really, is my in my oral health routine is the coconut oil pulling once a day.
Okay, so that's oil
So,
pulling. So to tell, I mean, people can look this up because I've looked this up.
of
But
course.
how long should you try and do that for?
So for me, start slow because when you first start it, it's the most weird feeling and it's oily and it doesn't feel right.
Yeah.
On Guard makes it taste better, clearly, but just a raw organic or cold pressed coconut oil, and it's the solid one. So you put it in like this, and as soon as you put it in your mouth, it does start to melt. So that's probably the weirdest thing to get your head around.
Yeah.
And then you're just doing it while you're swishing it around, absolutely everywhere. The time that the studies show to prevent decay, to prevent calculus sticking onto it, is around 20 minutes. That's the one. That's what you want to aim for.
Okay, amazing. I know some people do it in the shower, like you said, during
Yes.
meditation. So it's quite, you
Yeah.
can fit it in because otherwise it feels like 20 minutes. Where the heck am I going to get 20 minutes?
Yeah. Keep busy. Keep
Yeah.
busy, and it soon goes.
Cool. And you literally swish it, don't you? Are there any techniques? Because you're just kind of pulling it from the top.
Yeah. So the way that I do it is I'm using my tongue to push it up into all the areas,
Okay.
and then I'm pulling it through the teeth from the other way, the cheek wise. So
Okay.
it's kind of a dual action of the tongue pushing and then the cheek sucking. But eventually, I mean, you do it long enough. The weirdest thing is after maybe a month or two of doing it, you feel like all your muscles under here really aching. But that's also a good thing. And I'm sure we'll come on to the breathing later, but that helps with prevention of mouth breathing as well. So it kind of all ties into one.
Okay, and then just a silly question, which I'm sure some people out there might want to know, because when I did it, I found that obviously your saliva adds to it, bit of a
Yes.
So then, is it okay to like spit in between? Because I'm always like, oh my gosh, I've got to keep it all in my mouth.
The trick is put less coconut oil in, just a tiny teaspoon.
Okay.
But I keep it all in my mouth until the end of the 20 minutes and spit it into a bin because it blocks sinks. So yeah.
Okay, that's helpful tip. Okay, let's go with what you said at the beginning about food. What kind of nutrition then do you recommend for teeth hygiene?
So obviously, okay, this is really interesting actually because our teeth, like I said, outside of the teeth are mineralized 96%. So that's solid inorganic material like a crystal. In fact, they are crystals. They're formed of tiny little crystal lines through them. And they're called enamel prisms. And what happens is that if our mouth is in a state of acidity and if bacteria is allowed to stay in one area for too long, or your saliva is drying out because you're mouth breathing, not nasal breathing, then what happens is when you're in that state, bacteria create acid, or the saliva can't remineralize the teeth. So then what you have to do is work out, well, if the teeth are dissolving because it's an acid environment, how long can my teeth sustain that for? And the research shows really 2 hours a day out of a 24-hour period should your teeth be in a demineralized position. And if the other 22 hours in a remineralized position, in theory, you should never ever get tooth decay.
Okay.
And it's not just those things. They're the topical things. Obviously, we've got to talk about nutrients, minerals, how strong the teeth are, all of the things that help them form. But that, for me, is really key. And that comes down to, if you eat anything, your mouth's going to be more acidic for 20 minutes after you've finished. So let's say you eat a half an hour meal. I mean, that'd be pretty good effort if you're eating for a full 30 minutes. But, and it's not every day. And then you've got 20 minutes for it to get back to a neutral zone again. But the way that I do it to try and get it super neutral really quick, just get some water after you've finished eating, swish it around your mouth and swallow, and then it neutralizes all the acid and it gets you there quicker. So that's a really easy top tip to try and prevent things going. But in terms of food and eating, absolutely, fruit you're never going to worry about. Do not worry about, fruit. It's fine for your teeth as long as you're within those 2 hours a day. Okay. Vegetables all day, every day. Eat as many vegetables as you want to. It's really only your refined carbohydrates, and your sugars and sticky foods that get into places and just allow bacteria to eat from them and cause acid. It allows the teeth to dissolve.
Yeah.
So yeah.
Okay, so 2 hours a day. So right, so that little and often eating plan doesn't really work with your teeth, does it?
No, not with your teeth at all. And we see that a lot. And actually, a lot of our patients are very holistic minded and vegan and need little bits of nibbles to get them through the day because they're not having these big, hearty, wholesome meals. And actually, we find that they do have a lot of tooth decay. So you've just got to manage it. But it's just about knowing, you know, you don't know what you don't know, do you, at the end
Yeah,
of the day?
absolutely. And
So
if you were to eat nuts or something in between, that's okay because that's not going to create the acid.
no, yeah. Well, it will still
Okay.
create acid because anything, even though it's not sugar or carbohydrate, anything in your mouth creates a level of acidity. It's just less than. So it's all about balance. And actually, nuts is what I snack on, and it's a pretty good one to snack on.
Okay, that's cool. And I thought about alkalizing your, with water. That's a brilliant idea. Could you add a drop
Absolutely.
of lemon into that?
Absolutely, absolutely. Eat Wild Orange is here, and it's my favorite one. So that's my first. Well done, prize for you. But absolutely, to be honest with you, I only love Wild Orange the most because the chemistry shows it's got the most limonene. So it's for me, it's the one that supports your glutathione production the most, which is your natural detoxification system. So that's why I like Wild Orange the most, and it tastes lovely. I absolutely love the taste of it.
And it smells amazing. I love it. Okay, so we've done the tongue scraping, we've done the nutrition. What's like your next tip for people?
It's probably talking about the breathing, I think, because not many people understand that. And I know I've touched upon the mouth breathing, how it dries out saliva, so then things are left on the teeth longer than they should have been, and they're not wiped away because our saliva is not just water. It's got immune cells in there to help fight off anything. It's also got remineralizing calciums, phosphorus, all of these nutrients in your system. So obviously taking any good multi-source natural vitamin like LLV is going to improve your remineralization chances because it's going to be in your saliva, be in your system as it's coming into your teeth. Okay. And then the main thing for me and around breathing is, I say it to all of my patients, I'm sure you've heard this before, noses are for breathing and mouths are for eating. That's it, period. You don't do anything else, okay? And, a lot of the time when we do assessments on patients, there is, even myself, right? When I did it, I've worked with my breathing, my posture, my lip closure, everything, because a lot of the time, especially previous dentistry, when we had teeth out when we were younger for braces, or we've lost teeth at a young age because we didn't look after our teeth when we were younger, like many of us didn't. Our mouth is more closed, our jaw is more set back because it didn't grow and develop the way that we wanted it to. And it's all around nighttime. So actually one of the biggest tips for me is mouth taping at night. And everyone's like, what is this about? But we have no control of our mouth being open or not at night. So if you and your partner can brave looking at each other with like mouth tape on in the middle of the night, it's definitely worth doing because two things. Number one is at night, our saliva flow drops massively. So we have none anyway, really. And the second one is if our mouth's open and we're breathing through our mouth, if you think about that 2-hour period that I say in the day, imagine breathing through your mouth all night with no saliva and the bacteria is breathing for 8 hours while your mouth is drying out. That's got to be the most comprehensive thing that could cause tooth decay, I'm thinking. And I'm thinking it's like the biggest hidden epidemic for tooth decay that no one's really looked at, So for me, it's amazing. And also, it stops you clenching and grinding your teeth, which also cause tooth wear, because that's all around your airway and how easy it is for you to breathe at night, which is another whole different story.
That it's honestly fascinating. When you told me about that, I had no idea, and I don't think most people do. Like mainstream dentists don't teach that at all.
No.
And that's something we can all do. It's free, so it's just about teaching yourself to breathe through your nose. And I remember you saying as well, because the nose has the stuff in it to filter things as well. That's what the nose's job is.
Absolutely. Well, not even just filter. It's absolutely unbelievable when you really get into it. So yes, sinuses filter. They have all the immune cells. You've got your tonsils at the back of your nose, and then you've got your tonsils at the back of the throat. So you've got like 3 layers of filtration even before it gets to the back of your throat. Whereas that's just going straight to the back of your throat otherwise.
Yeah.
But for me, it's been proven now that within your sinuses, there's bacteria, special bacteria that live in a huge percentage of people. It produces nitric oxide. And when we produce nitric oxide, and you've probably heard of when you meditate and you breathe slowly, your whole system relaxes. And the reason is because normally your lips are together, you're breathing through your nose, you're producing nitric oxide, which is a vasodilator and relaxes your whole cardiovascular system, so they're not in that fight or flight mode. So it's not only just good for your teeth, it's good for your overall system again.
No surprise.
Which is just fascinating.
Everything's always connected, isn't it? It's amazing.
Absolutely.
That's so cool. And any oils to help with that, or is it a matter of just breathing through your nose?
Yeah, I mean, the more you breathe through the nose, so obviously the best thing is to be assessed by someone that knows what's going on, because you've got to be able to breathe through your nose. Taping your mouth a lot of the time is fine, but in certain cases you might not be able to. But the worst thing that happens is you take it off and you put it on the side. Mm-hmm. But what you can do this is subconscious while you sleep, by the way, you do take it off and you wake up without it on and you're like, oh, okay, maybe I didn't breathe at some point in the night and I must have just subconsciously taken it off. But air, here it is, okay. One of my other ones, is one of the most fantastic oils for clearing your nose, and I'm sure everyone's experienced that. And it's not as harsh as peppermint, doesn't wake you up as much, so you could even do it 10 minutes before bed if you're not too sensitive. Obviously, some people are quite sensitive, and it might wake you up and keep you awake a little bit. So test it out. But I do it last thing while I'm brushing my teeth, and I do it first thing in the morning. So they're the two things I do it to allow me to, especially now with COVID and me and masks that I have to wear all day now, they're much harder to breathe through your nose. So I have to try and really work on clearing my nose in the morning. But unless there's something structurally wrong, they will help lower the inflammation levels to allow you to breathe easily through your nose, okay. which is massive. And I saw someone mention TMJ. Basically, if anyone doesn't know, TMJ is your joint here, and it's called the temporomandibular joint. And basically, temporal is your skull bone, mandible is the joint, your whole lower jaw, and it's got these two little notches here. And how your jaw wants to be is it sits here, and there's a space between your skull bone and your jawbone, and there's a little disc that is in between your both bones. But what happens if someone's got TMD, which is the disorder of the jawbone, and we see it a lot through extra muscles, we see it a lot through from clenching, we see tooth wear, all of these kind of things. It means that your skull bone and jawbone is pushed up further and it's grinding on each other, which is releasing inflammatory markers and causing problems with your whole system. And it actually can be contributed to mouth breathing at night, because your airway, the whole thing for me is we're getting closer and closer to understanding why people are clenching and grinding their teeth. Before it was just, oh, you're stressed, and that may be an influence on what's going on. But actually now what we're finding is it's your airway that's compromised at night. And for you to keep breathing, you have to clench your teeth or grind your teeth. And it's really hard to explain, but remember when I was talking about the tongue at the back, and then you have your back of your throat like that. Mm-hmm. So let's say the back of your throat's like that. It's all muscle. Yeah. And what happens is when you sleep at night, everything lies back and it gets smaller, right? Yeah. If your tongue's in that airway and your jaw's open because you're mouth breathing, that becomes even more narrow. And then when we're breathing from our diaphragm down here, it's sucking air down and it closes. And when it closes, we have to be able to breathe. So our body subconsciously puts us into fight or flight, tenses all our muscles in our neck and opens the airway so we can breathe again. And when you tense, you clench your teeth and you push your tongue forward into the back of the teeth at the same time. And we have to work very slowly and carefully with your lower jaw and to bring it downwards and forwards. And then once it's at this place, we say, right, now we've got enough airway, we're not clenching and grinding anymore, we know how to do things. So it's a very interesting new concept, but we've been doing it for a couple of years now, and it's working wonders for a lot of our patients. And actually, I'm not allowed to say this because I'm not a doctor, but the depth of sleep is so much better. And my thing is, we're doing it to stop the grinding in the teeth, but actually the health consequences are fantastic in a good way.
Yeah, amazing. That makes a lot of sense. It's fascinating. And so using air perhaps in a diffuser as well.
Absolutely. And I think this diffuser here is the Roam, which is super quiet as well. Yeah. So it doesn't actually make any noise in the bedroom, so it's not going to wake you up.
Yeah, perfect. And then someone has asked, back to the oil pulling just quickly, can they use fractionated coconut oil with?
Absolutely can.
Yeah.
it's got some of the medium triglyceride out of it, which are antifungal. So I actually prefer the normal coconut oil, but you can, if you're away on holiday and that's easy to have, I do that as well. So
Okay.
that's the way that I do it. But it's still going to give you, don't forget, if you've got your essential oil in there, it's still going to give that benefit. So actually it's fine if you use an essential oil, but if you just wanted to, if you're at home and quickly, you just don't put another, just use the same one because it's got some more antifungal properties in it. But that's fine, you know, it's absolutely okay to use.
Okay. Excellent. Thanks, Seb. And a question that I've often been asked, or I've Googled actually as well. If you already have, or you suspect you might have a small filling somewhere,
Yes.
is there anything you can do to potentially reverse that, or at least maintain it? Like, what would be your suggestions with that?
I was actually speaking to the lovely Rochelle today about the same question. And what's happened is, so let's say that's your tooth. And let's say so this is the dentine layer, the inner bit, and that's your enamel on top, the strong bit that's not alive anymore. That's the only part of your tooth that's not alive.
Okay.
If there's a small hole in your enamel, we can never remineralize the enamel because there's no cells that are alive and can regenerate that.
Okay.
But what happens is, if you eat, what you need is like fermented omegas, and you eat this. I think there's a book called Remineralize Your Teeth by Remy. I can't remember the guy. It was an amazing book, and I've read it as well. And what they mean by remineralization is it halts and arrests the bacteria growth, and it turns the tooth color black where the decay was active. And the reason that it does that is because when it goes black, it means the bacteria have died off, they've left their staining, and it's stopped. And the tooth is perfectly hard in these areas. It will never have the structure that was once there. So that's why we do fillings, you know, to get back the structure, to stop the food from packing there. But yes, of course, you can actually stop tooth decay, and you can halt it in your tracks just through diet and nutrition. But you'll never grow the structure back unless we get this new stem cells technology or whatever it's going to be in the future. But yeah. It's fascinating concept, and I looked quite hard into it, and I've tried it on a few patients, and in kids that's all I suggest because I don't really want to traumatize kids with drills and anything like that. So we just get really hard on the diet, we get really hard on the hygiene, and we stop it in the track, and they look awful at the back of the mouth because they're dark and they're black, but actually there's no more pain. There's, you know, it's solid, it's remineralized.
Amazing. And so when you say you really look at the nutrition, it's what you told us before about the 2 hours is probably the key thing, isn't it?
For me, it's massive. Yeah. And the mouth breathing in kids is huge, because how many times do you walk into someone's bedroom and their mouth's wide open? So that's got to be the most amazing one.
Okay. And then what else with the hygiene? So obviously you've talked about the tongue scraping. Any other tips for the personal hygiene that we can do?
Yeah. For kids or?
Both kids and adults.
Kids is just getting them to do it, I think, isn't it? The hardest point.
Yeah, that's
but you know, it's trying to, and I think, you know, it's getting them on side and helping them understand and why we're doing things. And I think when someone understands, I think probably after the age of 5 to 7, that's when they really start to understand things, and it's not like, oh, I just don't want anything in my mouth, you know, anymore.
Yeah.
But
I mean, I see you've got the mouthwash there. So do you do flossing and mouthwash as well as part of your daily routine? And would you suggest that?
I absolutely do. So I do the tongue scraping, do the oil pulling. After my 20 minutes, I use the doTERRA mouthwash to, once I've spat it out, the oil in the bin, I use a mouthwash to get rid of everything and swish it around for about a minute. And then that balances all the bacteria and everything that I want it to be. And then that's how I use that one. In terms of flossing, I don't actually recommend flossing to a lot of my patients unless it's at the front teeth. So the front 3 teeth, they're the ones probably that you need to floss more than the rest. And the reason I don't recommend it for anything back, premolars and molars, is because they have roots that are kind of like concave like that. So when they're together, flossing just goes in and doesn't really get to that concavity. So what I use, and I'm sorry, environment, but these are the best ones that I've found to do the job, and they're tiny little plastic silicone things, and they have little knobbles on them, and I just put a bit of On Guard on it, or tea tree is another good one, and just go in between. Or should I try and do it?
Yeah, go on. We'll watch.
There you go.
Beautifully demonstrated, and nothing come out. There's nothing come out. Look, it's so clean.
The trick is, once it's in, you go up one side of one tooth, go back down, and then go upside the other tooth. Because what we want to be doing is cleaning the gums. This is all about gum health, really. What you've got to understand is if you get food trapped in between two teeth, sometimes you do need floss to get in between the contact points of the teeth.
Yeah.
But when you're flossing, for the most part, it's about gum disease and reducing that.
Okay, brilliant. And any other tips that you can tell us? I mean, you haven't gone, I think there's a few oils there that you haven't mentioned. Is a myrrh, like what do you use myrrh for?
Yes. This one, to be honest with you, I've gotten a bit fancy the more I've researched it, and I use this in my oil pulling now, but obviously On Guard is a great one. The reason I use myrrh is because I use On Guard in a load of different ways in my mouthwash and my toothpaste, and I'm getting exposure to that.
Yeah.
But myrrh, I mean, watch the convention. I went into a huge amount of detail into myrrh, but well, we can't watch it anymore, can we? But for me, it's anti-inflammatory. It balances the bacteria. It's just so oral health promoting, and you only need one drop. And I know it takes a while to get it out of the bottle, but it's, for me, that one is probably my favorite. And actually, the other one I've got here, Becky, is the spearmint. And there's actually been some studies that if you use spearmint and wild orange in your oil pulling, it actually whitens your teeth because it removes a lot of the stains within it. And obviously it leaves you with great smelling breath at the end of it because of the spearmint. But weirdly, the whole breath smelling thing mostly comes from your tongue. So if you've got decent oral hygiene and you always wonder, why do I smell my breath? Or why does someone, start the tongue scraping, because those little bits of food and bacteria stuck in the tongue, they're the things that start to smell. So really important to do that.
That's brilliant. And I'm glad you mentioned the teeth whitening thing, because that was going to be one of my questions, because that's often a thing people want to do, isn't it? And we don't want to really bleach our teeth, so it's a naturally. Then, so it's oil pulling with spearmint. Is there anything else you recommend for natural whitening?
Oil pulling in general is amazing, because if you think you're doing it daily, it's pulling all of those parts of the things that stain your teeth, out of the teeth every single day. So it's never building up, never getting too much.
Okay.
But the most important thing really is going to the dentist, getting them to clean the teeth if there are any bits that are staining and stuck to it. And we have a special machine at ours, which is like an airflow. It's not like a scrapey thing, and it's like spraying it's a bit like spray paint, I think, is the way to do it. And it's very lightly abrasive on the teeth, and you just see the teeth change color. Even when I'm oil pulling, I still get that done every 3 to 6 months just to keep on top of that. Because teeth do stain, they're porous, they're crystals, they have water in them. So that's the reason they stain.
Okay, that's cool. And then just one last question I want to open up, I think, unless there's anything else you want to say. But I see you've got the On Guard toothpaste there. What's your thoughts on fluoride toothpaste? And you recommend the doTERRA one then, do you? And
I recommend the doTERRA one, not just because of okay, maybe I should start with fluoride. So fluoride, if someone walks into my office and they've got decay everywhere, and I say, we're going to lose teeth unless we do something quickly, I give them high dose fluoride. And I say, this is not forever. This is just until it's stabilized, because fluoride isn't good for our overall system. We know that, right? Because it's a toxin overall. But if we need to, and they're not getting on top of their diet, nothing else is working, then 100% just do that, just to prevent losing teeth. Because I think malnutrition later in life for not having teeth to chew and eat food is probably a bigger thing than fluoride exposure, hopefully a not long-term solution anyway. So fluoride for me is used very rarely if I can't help them, but it is got a place for teeth, in the fact that unless you don't want to do all those crazy diet things like we talked about with remineralizing teeth and the nutrition, it stops it just as simply as having it in the toothpaste, because it does that. It remineralizes the teeth, using fluoride to make it stronger. So I 100% recommend this to everyone, not just for the teeth, but also for the rest of the tissues within the mouth, because it looks after all of the inflammatory levels and calms everything down. So yeah, for me, this is got a place in everyone's home, unless there's an absolute crazy reason why it should not. But I was one of those reluctant ones to switch to it. But I've been using it for 3 years now, I think. So it's excellent.
Okay.
One thing to note with it is it's not very abrasive, so it's very kind to your teeth, but it means teeth stain quickly and more easily. So, but that I combat that by having my teeth cleaned once every 3 to 6 months, whatever it's going to be. But if you didn't want to go and get your teeth cleaned, which obviously I recommend to do, you just use like a charcoal toothpaste for maybe a week in between, and that just keeps the stains off even more so.
Okay, that does lead me to actually that, because I've been told activated charcoal was good by someone, then someone said actually you shouldn't use it every day because it can actually wear off the enamel on your teeth. So is it something you use a little bit?
I use it periodically, but for
Okay.
me, if you look at the hardness of enamel and the hardness of charcoal, they don't even match. There's no way charcoal could destroy teeth. I mean, you look at the instruments that we use to clean teeth, that's stainless steel, and that doesn't damage teeth, right? At the end of the day. So I think maybe if you've got your gum exposed and you're brushing the gums too hard, then of course that will wear away teeth because it's more abrasive than a normal one.
Yeah.
But if you're just talking about cleaning the tops of the teeth and not going near the gum line, then I think it's fantastic.
Okay, that's brilliant. Okay, cool. Is there anything else, Seb, that you think we've left out that you want to tell people before we see if there's any questions that anyone has? And you've said so many amazing things. It's been brilliant, but just in case.
I don't think so. I guess really is if I guess the main thing for me is because not many people or dentists are aware of the breathing and the sleeping. I think the main thing for me is if you suffer with headaches, migraines, which can be multifactorial as well, but head, neck, shoulder pain, or even back pain that you're like, why is this not getting better? Definitely get someone to look at the way that your bite is, to have a look at how your jaws align, to start maybe just trying the mouth taping to see if that takes the pressure off your teeth. Because it's all around putting pressure on your teeth at night and spasming the muscles and then putting areas of other muscles into more spasm. So it's really important to just try and see if you can get there yourself. But if not, just reach out and obviously I can help you. But the main things are those. I mean, in men tend to crack and grind and break everything in their mouth, whereas women tend to have the head, neck, shoulder pain and sensitive teeth, from the gums receding and stuff like that. That's normally the way that it goes with anyone that's suffering with jaw joint issues or grinding their teeth.
That's interesting. That's so interesting.
I think someone just asked on our chat as well.
I have. Go on.
About.
A gum
I don't
shield.
know. I just saw something pop up. Something about a gum shield. Yeah, I think.
Said, would you recommend a gum shield? That's on there.
Well, yes, but it has to be the right one that's very thin, and it's not just wearing at night. This is where it differs from the conventional wisdom. Mm-hmm. We wear something that you wear all day apart from eating, and then at night while you're sleeping as well. And you have to start at like 1 mil thick, and you build up every 6 weeks a mil until we're at that place where the gum shield's not being cracked anymore, where the airway's got enough support because the jaws come downwards and forwards, where the jaw joint and the head, neck, shoulder pain subside. There's lots of things to manage it, but if it's a big gum shield that just goes in your mouth and you're just chewing through it like you wear with everything else, yes, that's protecting your teeth, but actually, is it protecting the rest of the body? Are you still getting that head, neck, shoulder pain? Are you still getting those headaches because of the pressure you're putting on the muscles still? And that's what we're trying to get to the bottom of. So it's a good question, to be fair. It's not a conventional gum shield. It's almost like an invisible brace that we build up slowly. Mm-hmm. A very thin one, a retainer, I guess you could liken it to.
Yeah. Thanks, Seb. Any tips on tonsil stones?
Oil pulling will 100% help with tonsil stones because it will start to pull everything through.
What are I've never heard of tonsil stones. What are they?
So tonsil stones, to be fair, if you get tonsil stones, I think usually a lot of the time I've found in patients, it's foods that you're slightly intolerant to. Like I had a few patients that nuts, for example, they get caught when they're swallowing in the tonsils, and usually the tonsils are slightly inflamed anyway. So you really want to be trying to reduce inflammation within the tonsils by not mouth breathing, right? Because when we breathe through our mouth, all of the air, the bacteria, the humidified air goes to the tonsils and causes inflammation. If you've suffered for lots of tonsillitis when you're younger and you've got scar tissue in the tonsils, then there's not much you can do with that because they're slightly bigger anyway. But you want to just try and minimize inflammation and then look at the foods that you're eating. I don't really recommend picking them out because I think that can cause more trauma to the tonsils. They're tiny little build-ups of, it's almost like calculus or food and bacteria gets on it, and they actually can be another cause of bad breath. So I would say try oil pulling and see if that helps. But if you're breathing through your nose, then actually bad breath doesn't happen as much, right? Unless you're talking, because you need to talk by breathing out.
Yes, that's true. Okay, you've got so many lovely comments here, which be lovely for you to read through. They said amazing information, so easy to understand, fascinating, brilliant. Okay, a question. I think this was the Chinese medicine, wasn't it? How can you find out which tooth is linked to which organ?
So there's loads of different charts on the internet. Just if you Google tooth meridian chart, there's a few. I mean, a lot of them are. I guess the hard thing to understand is what tooth relates to what, but usually they're American style, and it goes from the upper left to the upper right, and then so that's your. And in dentistry, it's always flipped, so it's a bit confusing. So the upper left would be your upper right tooth, and work your way across to the other upper left tooth, and then down. So it's like a clock, but you start upper right and go down. So just Google tooth meridian chart, have a look at them, and then if you get a good one, they'll say what organs it's related to, even joints or endocrine systems and hormone systems. There's a lot of things that are related to them, and actually. We have one of our treatment coordinators at the practice is an acupuncturist, and she's saying that the teeth are actually the end point of the meridian energy flow. So it's really interesting.
Wow.
So it's the end point of the line. Who knows? It's I love it, and I think it's fascinating. And I can never diagnose or say, remove this tooth and you're going to be better, but it's just fascinating to see and trust.
Yeah, so I guess then you have no harm with addressing that organ as well, and like going, okay, so my lungs need some help and support too, so I'll support my lungs, support my tooth.
Absolutely, and then you go and you look at what you can do to support that in every way possible.
Yeah, it's fascinating.
Because, like we said, we don't know which way it goes.
No, to do both.
Yeah.
Hopefully, get it good. Okay, which oils should you use for a person who has gum disease?
So for sure, using whatever you can fit between your teeth, but I recommend these are called TP sticks, and they're really good. And they've only just released them a couple of years ago. And I was always using the brushes before, but the problem with the brushes is you poke yourself in the gums and you cause more inflammation and bleeding. Yeah. Whereas these are very, well, you can see, wobbly, right? So you never bleed with these. And the oils that I recommend the most for gum disease is 100% using On Guard. You always need to go to your dentist and hygienist team and therapist team, because sometimes if there's stuff below your gums, you can't reach that yourself, and you need to do your best. But going back to the clenching, the grinding, the breathing, gum disease is, yes, it's bugs within the gums, but actually what's causing the bugs to be there. And a lot of the time, when we're clenching on our teeth at night to open our airway, teeth are held into the bone with ligaments. And these tiny little ligaments are put under stress when we're putting pressure on them. So actually, if you're rocking your teeth at night without knowing, you're opening up those ligaments, and things can get into your gums. And hey, it's not proven by science yet, but a lot of the people we treat, we do the hygiene therapy work at the same time as bite work and aligning the two together. And within normally 3 months, they're both gone and don't recur, which is fascinating. And I know a lot of patients that come to us have been having gum treatment with their NHS team for many, many, many years. And it's always been constant.
Wow. That's amazing. Thank you, Seb. Would you recommend using On Guard toothpaste for a toddler? Is it okay for a toddler, would you say?
Absolutely okay for a toddler. I mean, if you think about the flip side of that, we give our babies and toddlers and kids fluoride toothpaste, and that's got systemic effects in it. So I think anything that's as natural as doTERRA, just use less of it. And the way that I look at it is, toddlers, when for an adult it's like a pea-sized amount, you literally just have a smear-sized on the toothpaste. That's the best way of doing it.
Perfect. And I always actually put water on top of the toothpaste, but is that wrong? Like you should probably just use it neat. I've just always done that.
Yeah, it's a good question, isn't it? Do you know what? I realized this when I was probably in my late teens, and I said to myself, I used to get the whitening toothpaste back then because I was so vain. And I noticed that if I didn't dilute it with water before I brushed my teeth would look whiter. So now I've carried that on to use everything. So if you, like you say, if you put it neat on, concentrated, it's more concentrated in the areas. Yeah. And actually you shouldn't rinse your mouth at the end of it, so you can leave all these good things on your teeth. But I mean, it depends how much you can get away with the taste or not.
Yeah, okay, that's interesting because obviously with fluoride you want to get rid of it, but with On Guard toothpaste, leave it on as a barrier, protective kind of thing. Okay.
Absolutely, yeah, absolutely.
How bad is the stuff from oil pulling if you accidentally swallow it? Been there, been there. It's not very
It's
nice.
not advised. Not advised, but it's, you're not going to die from it. Don't worry about it. It's just got more bacteria in it because you've at the same time, if you've been swishing around with an oil and the coconut oil, you've actually probably eliminated a lot of the bacteria within it. So
Okay. Cool. I think we've almost come two more. So what type of tape do you use to tape your mouth with?
yeah, it's a good question. There is specific tape that you can get for mouth breathing at night, but I just get surgical tape
Okay.
from wherever it is, and it's not that sticky. And I just do a little postage stamp over my teeth, over my lips. Sorry, not my teeth. And yeah, that's all I do. And just, I mean, give it a go and see.
Yeah.
It will take a while. Just be persistent. I would say for the first month, you'll probably keep waking up with it everywhere. But if still you can't get used to it and you're like, no, it never happens, that's when we know that there's less space in your mouth than there should be. So we need to do some jaw work and create some more space for your tongue because there's normally not enough. That's the way that we can triage it as well.
Okay. Amazing. One last question, and then we'll let Seb go and have his dinner. Thanks so much, Seb. Seb has literally come straight from work, by the way, to this with like 5 minutes to spare, maybe, Seb. I don't know.
Oh, we did all right there, didn't we? We did it.
You did amazing. So how can you stop receding gums, and can they regrow without surgery? Last question.
In really good question. So there's one thing that's really everyone should know, and most dentists do pick this up, is if you overbrush. So don't use don't use a hard bristled brush. And actually everyone's gums have got different thickness of a biotype. So if you've got very thin gums anyway and they recede quite easily, you should probably use an ultra soft brush. And there's special ones called Curaprox. And these Curaprox ones are a bit like the microfiber, that you use to clean or whatever it is.
Yeah.
They've got like 1,700 bristles in them, but they're ultra soft, but they do a really efficient job. So they keep your gums very clean. So if you've got if you're prone to that, use a Curaprox ultra soft brush and try that.
Okay.
But again, going back to this thing that you probably all think I'm absolutely in love with is the clenching, the grinding at night. And even if you're not grinding at night and you can't see tooth wear on your teeth, a lot of my patients actually show clenching through the x-rays and things that we show and the recession that they have. Because remember when I said earlier, when you're clenching and you're moving your teeth at night without knowing, that teeth is in the bone with ligaments. And if there's too much pressure on them, they actually just say, okay, I can't hold on to it anymore. And they recede. And it's just a very slow process that happens over time. You can't regrow gum unless you have surgery, unfortunately. And there's some fancy surgery that we can do. We take blood from the arm and we spin it and create a super blood clot, and we open up where your gum is and we pack it in there and stitch it in. It's pretty invasive surgery. So if you're going to have that type of surgery, you really want to know that you're not going to get your gums back to where they were because you're still clenching and grinding. So you kind of want to cover everything off before you go down that route. But yeah,
Okay.
unfortunately it is surgery. But you can stop the progress of it through other things.
Okay, amazing response. Thanks, Seb. There is just one last question, sorry, and then please don't ask any more questions on anyone because we've got to let Seb go. But what is good for ulcers in the mouth or vocal mucosa lumps?
Okay, yeah, so ulcers in the mouth can be caused by a lot of things. It can be caused by trauma, so biting, and then a little bit of bacteria gets in there and it causes some painful ulcers. Or it can be caused by minerals and nutrient deficiencies in your body, like iron, vitamin B12, folate. They're the most common ones. But also the oil that I use to stop the pain is clearly On Guard, because you literally just dab it on there. It helps with the bacterial overgrowth and it calms it so you're not feeling the pain triggering all of the time. And yeah, that's in the buccal mucosa and your lump, wherever it may be. You can just dab it on there. Obviously, it numbs it a little bit as well. So I've never had anyone complain with not being able to speak after it though. So we're okay.
And also with kids, because my kids have sometimes had tired ulcers, run down ulcers. And if the On Guard is a bit too
Yes.
strong for them, then I've used frankincense as well, because that's like, if in doubt, use frankincense. So I did that, and that seemed to help too.
Absolutely.
So as a not as
Absolutely. Yeah.
so
Um,
go on.
Sorry, I think it just cut out a bit. No, I was just going to say ulcers can be caused by stress as well, as with everything. So it just causes general inflammation in your body.
Yeah.
But yeah, so meditate and relax and try and get on top of life, I guess, is the hardest thing to do in the world. But it does keep you into a less prone chance.
Mm-hmm. Brilliant. Seb, this has been incredible, amazing. Everyone's loved it. And I know lots of people watch the recording, but you can tell your passion for dentistry and holistic dentistry. And it's so lovely to hear you speak, that you really speak with knowledge and from the heart as well. So really lovely. Thank you so, so much.
That means so much. And thank you for having me. It's been an absolute pleasure.
Yeah, thank you. And thanks everyone for joining us as well. And yeah, you can share this with your friends as well. Yeah, enjoy your evening, Seb. Have a nice evening.
See you later.
Bye.